Ladies and gentlemen, Assalamu alaikum. It is my pleasure to invite you all to watch my educational video, Influenza and COVID-19, Similarities and Differences. Influenza and COVID-19, Similarities and Differences. I am Dr. Sheikh H.M. Isbahul Islam, Associate Professor, Respiratory Medicine, Sylhet MH Osmani Medical College. This is the image of the medical college where I do work. Similarities and differences between flu and COVID-19. Influenza and COVID-19 are both contagious respiratory illness, but they are caused by different viruses. COVID-19 is caused by infection with a new coronavirus called SARS-CoV-2, and flu is caused by infection with influenza virus. There are some key differences between the flu and COVID-19. COVID-19 seems to spread more easily than flu and is cause more serious illness in some people. It can also take before people show symptoms, and people can be contagious for more longer. There is currently no vaccine to prevent the COVID-19. The best way to prevent infection is to avoid being exposed to the virus. Signs, symptoms, similarities. Both COVID-19 and flu can have varying degree of signs, symptoms ranging from no symptoms to severe symptoms. Common symptoms that COVID-19 and flu share include fever, cough, shortness of breath, fatigue, sore throat, runny nose, muscle pain, body ache, headache, and some people have vomiting and diarrhea. The differences between the influenza and COVID-19. In influenza, flu viruses can cause mild to severe illness, including common signs, symptoms: fever, cough, sore throat, runny nose, headaches, fatigues, and some people have vomiting and diarrhea that I have discussed earlier. But in COVID-19, it seems to cause more serious illness in some people. Other signs, symptoms of COVID-19 different from flu may include changes from loss of taste and smell. This is important. In COVID-19, some patients may lose taste or smell. Older adults and people who have severe underlying medical conditions like heart or lung diseases or diabetes seems to be higher risks for developing more serious complications from COVID-19 illness. People with COVID-19 had wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to virus. People with these symptoms have COVID-19 fever or chills, cough, shortness of breath, fatigue, muscles or body aches, headache, new taste or smell, no loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting. How long symptoms appear after exposure to infection? The similarities are both the COVID-19 and flu, 1 or more days can pass between a person become infected and when he or she starts to experience illness of symptoms. Differences are, if a person has COVID-19, it could take them longer to develop symptoms than flu. Flu, typically, a person develops symptoms anywhere from day 1 to day 4 after infection. And in COVID, on the other hand, COVID-19, typically a person develops symptoms after 5 days being infected. But some symptoms can appear as early as 2 days after infection or as late as 14 days after infection. And the time range can vary. How long someone can spread the virus? What are the similarities? Similarities are both the COVID-19 and flu. It is possible to spread the virus for at least 1 day before experiencing any symptom. And the differences are, if a person has COVID-19, they may take contagious for a longer period of time than if they had flu. Most people in flu are contagious for about 1 day before they show symptoms. Older children and adults with flu appear to be more contagious during the initial 3 to 4 days of their illness, but may remain contagious for about 7 days. In infants and people with weakened immune system can be contagious for even longer time. In COVID-19, it is possible for people to spread virus for about 2 days before experiencing signs and symptoms and remain contagious for at least 10 days after signs and symptoms first appeared. If someone is asymptomatic or their symptoms to go away, it is possible to remain contagious for at least 10 days after testing positive for COVID-19. How it spreads? What are the similarities? Both COVID-19 and flu can spread from person to person, between people who are in close contact with one another within 6 feet. Both are spread mainly due to droplets made when the people with the illness COVID-19 or flu cough, sneeze, or talk. These droplets can land in mouths or noses for people who had nearby or possibly inhale into their lungs. Similarities. It may be possible that a person can get infected by physical human contact like handshaking or hands, or by touching a surface or object that has virus on it and then touching his or her mouth, nose, or possibly their eyes. Both flu virus and virus that causes COVID-19 may spread to others people before they begin showing symptoms with very mild symptoms or who never develop symptoms. Differences are, while COVID-19 and flu viruses are thought to spread from similar ways, COVID-19 is more contagious among certain populations and ages than flu. COVID-19 has observed to have more super spreading events than flu. This means the virus caused COVID-19 can quickly and easily spread to a lot of people and result in contagious spreading among the people as time progresses. People at high risk for severe illness. What are the similarities? Both COVID-19 and flu illness can result in severe illness and complications. Those at high risk include older adults, number 2, people with certain underlying medical conditions, Number 3, pregnant people. The differences. The risk of complication for healthy children is higher for flu compared to COVID-19. However, infants and children with underlying medical conditions are increased risk for both flu and COVID-19. Differences. The risk of complications for healthy children is higher for flu compared to COVID-19. However, infants and children with underlying medical conditions are at increased risk for both flu and COVID-19. In influenza, young children are at higher risk of severe illness from flu. People at high risk for flu complications. In COVID-19, school children infected with COVID-19 are at risk of multi-system inflammatory syndrome in children, but rare severe complications of COVID-19. Complications. What are the similarities of complications? Both COVID-19 and flu can result in complications including pneumonia, respiratory failure, acute respiratory failure, sepsis, cardiac injury. Multiple organ failure, worsening of chronic medical conditions, inflammation of the heart, brain or muscle tissues, secondary bacterial infections. The differences of complications. In influenza, most people who get flu will recover in a few days to less than 2 weeks, but some people will develop complications. Some of these complications are listed above. In COVID-19, additional complications associated with COVID-19 can include blood clots in the veins or arteries, veins, heart, legs, and brain. Number 2, complications include multi-system inflammatory syndrome in children. And third one is COVID-19 emergency warning signs. Thank you. Thank you all.